Hello, we're the Gray Group and we'll be presenting our medical emergency, which is cardiac arrest, in this video. What is cardiac arrest? Cardiac arrest is a sudden, unexpected loss of heart function, breathing, and consciousness. Cardiac arrest usually results from an electric disturbance in the heart. It's not the same as a heart attack. The main symptoms is loss of consciousness and unresponsiveness. Type of cardiac arrest. The two shockable rhythms are ventricular fibrillation and pulseless ventricular tachycardia, while the two non-shockable rhythms are asystole and pulseless electrical activity. We will be going over the protocol of this medical emergency in future slides. The ASA classification of cardiac arrest patients varies from patient to another. It depends if the patient has any other health conditions. However, most likely patients who have cardiac arrest issues would be classified as an ASA 3 or 4. Chain of survival. Immediate recognition of the medical emergency and activation of EMS, early CPR, rapid defibrillation, effective advanced life support, integrated post-cardiac arrest care.
Common medications. Adrenaline, the first drug given in all causes of cardiac arrest. Adrenaline concentrates the blood around the vital organs, specifically the brain and the heart, by peripheral vasoconstriction. It is also strengthens cardiac contractions as it is stimulated the cardiac muscles. Adrenaline can be given repeatedly during a cardiac arrest until the condition of the patient is improved. Amiodarone, it is given during cardiac arrest to treat specific cardiac arrhythmias, mainly ventricular fibrillation and ventricular tachycardia. The first treatment for ventricular fibrillation or ventricular tachycardia should be electrical defibrillation. If that did not work, amiodarone should be given.
Continuing on with some common medications, we have a medication called lidocaine, and this is used to slow down a very fast heart rate. We also have a medication called atropine, and this blocks the effect of the vagus nerve, and it also slows down your heart rate during cardiac arrest. The last two common medications include calcium chloride and magnesium sulfate. Calcium chloride is essential for the contraction of muscular tissue throughout the body, and if given during cardiac arrest, it can stabilize the contraction of the cardiac tissue after metabolic changes have caused instability and arrhythmias. Magnesium sulfate is an important electrolyte involved in the contraction of the muscle tissue, and a reduction in blood levels of this element can frequently cause cardiac arrhythmias, often leading to cardiac arrest. Some risk factors of cardiac arrest include a family history, smoking, high blood pressure, obesity and diabetes, previous heart attacks, increasing with age, using illegal drugs such as cocaine, chronic kidney disease, nutritional imbalance such as low potassium, and excessive alcohol intake. Differential diagnosis. What is this? It's a process where the doctor differentiates between two or more conditions that could be behind a person's symptoms. This can include their medical history, physical examination findings, and diagnostic testing. Heart attack is also often mistakenly used to describe cardiac arrest. Heart attacks are caused by a blockage that stops blood flow to the heart, and cardiac arrest is caused when the heart's electrical system malfunctions. What can you do to prevent cardiac arrest? First thing you should do is quit smoking, maintain or lose some weight, track your daily fluid intake, limit alcohol consumption, limit caffeine consumption as well, live a heart-healthy diet, engage in physical activity, and reduce your stress. These are some things a dental hygienist can do in order to prevent cardiac arrest happening in the dental chair. Identify the client at risk with a thorough medical history check. Recognize the signs and symptoms of the patient. This can include chest pain, trouble to breathe, palpitations, fainting, nausea, and vomiting. If any of these symptoms do occur, promptly refer the client to a physician. If coronary symptoms also occur, rapidly assess them to EMS. In the next slide, we will include a video on how to respond to an emergency protocol of cardiac arrest in the dental chair.
I'm good. How are you?
I'm good. My name is Rama. I'll be taking care of you today. So I'm just going to ask you a few questions before we start with the dental treatment. So have you had any doctor visits recently or any changes to the medical history or medications?
I went to the doctor for some chest pain. It went away before I got there, and I just thought it would be a good idea to let them know.
Oh, good. Glad that you went to the doctor to get checked up. And did they give you any medications for the chest pain?
She gave me nitroglycerin, but I didn't take it.
Okay. Do you have your nitro with you today?
I do.
Okay, perfect. We'll make sure that we have that available during this visit. Have you had any chest pain since the last?
I haven't.
Okay, good. How long did the last chest pain last?
About 10 minutes.
About 10 minutes, okay. All right, so now we're going to be taking some vitals to make sure that everything is good and within normal limits, and we'll go from there.
Okay.
Okay, so it's a little elevated, but it's still good to keep going with the dental treatment. So now we have another exam that we have to do. It's called the extraoral exam.
Mm-hmm.
Just going to examine your whole face and make sure that everything is still within normal limits.
Okay. That's a little bit tender right in there.
Right here?
Yeah.
Where's the pain coming from?
My neck. It's been hurting, kind of a lot lately.
Yeah. Okay. How about now? Are you feeling any different now?
It's still a little bit tender. My chest is really starting to hurt. I'm having a lot of chest pain.
Okay. I'll administer your nitro. I have a code right at Unit 2.
If patient is unresponsive, not breathing or normal breathing, activate emergency protocol response system. Have to the next door alert other staff members. If there is no pulse, initiate CPR. Begin cycles of 30 compressions in 2 breaths if no oxygen tank is nearby. Place board behind patient's back for support and remember to check pulse every 2 minutes. Continue with CPR to dentist arrive with AED. At this time, the student with the emergency can call 911. CS assistant will be recording medical emergency and vitals via paper. Turn AED on and follow prompts. Place one pad on patient's right chest and then place other pad on patient's left rib area. Let the AED analyze. If shockable, give one shock. Make sure no one is near patient. If not shockable, resume with CPR for 2 minutes and check rhythm. Continue until ALS providers take over or the victim start moving. Remember to have nearby students waiting for EMT outside.
Next, we're going to talk about other emergency protocols, including intruder threat alert, which in the event of an intruder, we're going to call 911, notify the school incident coordinator, signal code to alert lockdown. Do not confront the intruder. We're going to hide in the classrooms that you see to the right, which is 404, 414, 503, 515A. We're going to obtain information about intruder looks and whereabouts, keep calm and quiet, and avoid any reckless actions. The shelter in place. Safety personnel will direct shelter in place areas. Stay away from doors, windows, and vents. in the event that there is a window, we're going to make sure that all of the windows are covered and also make sure that everything is closed and locked. Safety personnel will notify everyone when it is safe to come out. In the event of an evacuation, the school incident coordinator of public safety will give the directive to an evacuation. We're going to travel down Logan Street to We Transport LLC, which is a bus company, and take all of our personal belongings with us if it is safe to do so. We have to make sure we close all doors behind us when exiting the building, remain calm and in a safe area until the school incident coordinator or safety personnel say it is safe to return. Reporting and managing exposure. In the event that body fluid of a patient reaches a clinician, we need to wash the area with germicidal soap. If the exposure is mucosal or the wound is large enough to irrigate with copious amounts of saline or other clean fluid. If exposure involves eyes, rinse with saline solution if there is no washing station available. Save gloves for inspection where applicable. In the event of a needle stick injury, an incident report needs to be completed along with medical evaluation, post-exposure evaluation, and follow-up. This includes HBV or HIV, counseling, evaluation of reported illnesses, and if possible, identification and documentation of the source individual and its HIV, HBV, HCV infectivity. If consent is obtained by the source, testing will be done. Post-exposure prophylaxis is indicated when medically available. With broken tip retrieval, notify nearby students to get perio retrievers that are hanging in the sterilization bag on the CS bulletin board. Instrumentation needs to be stopped immediately and the client needs to be informed of what is happening. Low or high-speed suction should be discontinued, and the client should use a cup to expectorate in the event that the tip is floating in saliva. The following are techniques for extraction. Re-instrumentation with another instrument to tease out from some gingival areas and catch with gauze. Or, use the magnetic tip perio retrievers that are shaped like thick explorers or probes to draw and grab tip fragment. Radiographic examination may be helpful in locating a metal tip that cannot be retrieved. Complete visual inspection of the oral cavity is initiated if metal tip is located inside or outside of sulcus. Gauze squares are used to wipe the vestibular area and under the tongue. If the tip still cannot be located on a chest x-ray, must be ordered to rule out the possibility of aspirating the fragment. Document instrument breakage on specific tooth or site and measure. The measurement should be in reference to another unbroken instrument. Complete the incident disclosure to client with signature, client response, follow-ups, referral, and procedure results.